Infertility is one of the diseases affecting the reproductive system, with approximately 10-15 of couples aged 18-45 infertile. The couple is described as suffering from infertility if they do not succeed in achieving pregnancy after a full year of regular intercourse without the use of protective methods of pregnancy. Symptoms of infertility. Being unable to conceive is one of the most important symptoms, and may experience some other symptoms as follows. Irregular menstruation, changes in hair growth in men, impaired erection. Causes and factors of risk of infertility. The pregnancy begins by meeting the egg that reaches the trumpet with the sperm that is flung into the vagina, moving through the uterus to the trumpet to fertilize the egg. In 40 of infertility cases, a woman is responsible, and in 40 of cases a man is, and in 20 the cause is unknown. Causes of infertility in women. Obstruction of horns caused by inflammation or pelvic surgery, or endometriosis, ovulation disorders, unclear reasons. Causes of infertility in men. Genetic factors, disorders in sperm production, whether in number or function, erectile dysfunction, blockage in the conductive channels of sperm, psychological pressure and anxiety. Risk factors for infertility. It is preferable to go for some tests after 6 months of pregnancy attempts in some cases as follows. Irregular menstruation. The suspicion of checking me is improper. Suspicion of uterine disease. Perform previous surgery in the uterus or ovary. Women's ages over 35. Complications of infertility. If you do not try to treat the condition at the earliest time, this may cause a lifelong inability to conceive. Diagnosis of infertility. After knowing the pathological and family record, infertility is diagnosed by conducting many tests for both spouses as follows. Sperm screening in number and movement, ovulation assessment tests, uterine and trumpet scans, through ultrasound imaging of the uterus, examination of sperm transmission in cervical mucus, laparoscopy. Infertility for the couple can be treated by the following. Increase the number of intercourse, especially during ovulation where it is preferred to be more than once during one day. In vitro fertilization of IVF, or laparoscopy surgery. In case of obstructions in horns. Regulate ovulation by medication, such as clomiphene, or injection of gonadotropic hormones, most of which are produced today by genetic engineering. The combination of medication treatment with intrauterine vaccination increases the chances of success of pregnancy. There are no specific ways to prevent infertility, but what comes can be followed. Avoid smoking and consuming alcohol. Reduce the use of medications that affect fertility as much as possible. Reduce your caffeine intake. Exercise regularly.